We go.
I don't know what's happening.
Okay, so hi everybody, I'm Reagan. I'm a Sharon Richardson's travel CNA, and I am a student at Lakeshore Tech College. This is for my oral and interpersonal communications class. I'll be giving you an informative speech today about hospice nursing. So whenever you're ready. So hospice nursing. Hospice nursing is one of the most rewarding professions there is in the medical field. Sharon Richardson Hospice out of Sheboygan Falls, who I work for, has been created on one of the sweetest love stories there is. The wife, Sharon, was in the end-of-life stage, and her husband was caring for her. Before this, the two were inseparable ever since high school. They were high school sweethearts. They created a wonderful life built around family values. When Sharon was passing, she had one last wish, and that was to have a facility where people in the end-of-life stages could go and get exceptional care. And hospice nursing is meant to provide the best quality care, emotional, physical, and mental. End-of-life care is a type of care that is provided for a person who is nearing the end of their life or in the end and or advanced stages of a terminal illness. There are two types of care that can be provided throughout the end-of-life stages, and those are hospice and palliative. Hospice care is a type of care that is provided once it has been decided that the patient is no longer going to recover or are reaching the end of their life. The care that is provided is strictly for comfort and to make sure that the dying process is as peaceful and comfortable as possible. On the other hand, palliative care can start whenever. It can start at the diagnosis of a terminal illness, throughout treatment, and remission as well, if possible. The end-of-life process is very overwhelming and can be very stressful for most. There are many things that can be shown throughout this process, but there are a few things that are widely taught to families. Physical changes such as coldness in extremities, uneven skin tone, or this thing we call mottling. It's blue and purple spots that you'll see in like fingers and toes and hands and feet. What it is basically just a lack of circulation throughout the blood vessels, and it kind of just proves that the heart is shutting down. Mental changes such as increased confusion, hallucinations, and reduced responsiveness are all expected during the dying process. As far as what your loved ones are feeling, there really is no straight answer for that. You can expect that they are just feeling really tired and detached from reality. Even though your loved ones may not be able to respond to you physically or verbally, please still talk to them. They can still hear you and feel you. During hospice care, there are many services that are offered, but the one that seems to be very helpful for not only patients but their families as well is the mental and emotional care aspect. Again, the end-of-life process is very stressful and very overwhelming. There are a lot of things that come with it. There are certain services that can help you along with that. Psychosocial services, they focus on the psychological and emotional well-being of the patient and their families. This type of care is purely focused on self-esteem, adaptiveness, and communication. During the end-of-life process, you lose many abilities and are no longer to complete simple tasks on your own, and this can really be a blow to somebody's self-esteem, especially for our patients who've been super independent their entire lives, so that's super hard for them. Our goal is to positively highlight the skills that the patients can still complete on their own, rather than negatively focusing on what they cannot do anymore. And it is still very vital for the patient to be as independent as possible. And some feelings that patients have during this process is, how am I possibly going to be able to live with this? The psychosocial services focus on that and adaptiveness, whether it be this new way of life or the disease that is seemingly tearing their world apart. Adaptiveness in hospice is a plan that is created based solely on comfort of the patient. This plan can include medications, routines, and symptom control. Another major part of psychosocial care is communication. The ability to communicate is something that we often take for granted, and we don't realize how often we use communication throughout our daily lives until we're no longer able to communicate anymore. So something that is widely taught to families and stuff like that is how to communicate with their loved ones when they do become, or when they do have a decreased responsiveness level. So we teach them facial expressions and regular communication. So regular communication would just be, please talk to your loved ones. Like I said, they can still hear and feel you. And then facial expressions. When somebody is actively dying, they can exhibit facial expressions to kind of exhibit different emotions that they're feeling. Like they can still smile, sometimes you'll get a little giggle and stuff like that. But the other thing that is very, very important is to realize that if a loved one is wincing and stuff like that, that means they're in pain. And again, with hospice, we want to make sure they're as comfortable as possible. During these trying times, that many people are lost as to how they can ask for these services. The truth is that you really don't have to ask. They're automatically provided to you, but you do not have to take advantage of them if you do not want to. Social workers and case managers are always readily available to you and for any questions that you may have. There are also resources outside of hospice that you can seek, such as therapy, spiritual help, and coping mechanisms. There are many types of therapy that are meant for patients or their families going through times like these. Although hospices have their own spiritual programs, many people have certain like religions or people that they do prefer for that kind of stuff. And also the other resource that is very helpful are coping mechanisms. As you know or may know, the grieving process can be expressed in 5 steps, which is denial and isolation, anger, bargaining, depression, and acceptance. There are many coping mechanisms that can be used, but the most effective that we have found throughout, especially Sharon Richardson, is just sharing your feelings with other people and keeping a journal. Like really, journaling is very, very underrated. Like having a safe space to express all of your feelings, especially during times like these, it can like take a huge weight off of your shoulders, and it's very, very helpful. It also helps with just kind of being at peace with what is going on and kind of being able to help yourself through what is going on. The other big aspect of care that is offered is obviously physical care. Physical care is a huge part of nursing and is taken very seriously because you're entrusted with another human being and your families are trusting you with their loved ones. Once you are admitted to hospice, you are automatically offered a DNR or a do not resuscitate order. So that is to say if your heart were to stop, that it gives paramedics or anybody else permission to not perform CPR or basic life support. Although everybody is offered one, not everybody needs to sign one. It's totally up to the care of the patient, what the patient wants, what the family wants. But during the physical care process, it is extremely important to maintain our patient's privacy and dignity. There are a bunch of cares that are offered, and a lot of these are very personal care. So like showers, bed baths, perineal care, nail and foot care, and a bunch of other things that you can think of. For example, for keeping a patient's dignity intact is if you're doing a bed bath, do not expose any extremity that you are not actively washing. So like if I was actively washing like the left leg, that would be the only thing that would be exposed. And then also the first thing that is taught for training hospice is to honor the families and patient's wishes. Like I said, you are being entrusted with the care of another human being. It's very important to take that very seriously. Another thing that is also very interesting about hospice is that staff can administer care virtually anywhere. Because hospice is based off of comfort, staff can provide care in nursing home facilities, assisted livings, and most of the time patients' homes. For most patients, being in their own home is especially comforting and offers them a peace of mind being in a familiar space. Because care can be offered anywhere, hospice staff needs to keep a couple good things in mind. That includes always being polite, maintaining a professional manner, and please remember good body mechanics, because sometimes in people's homes, floors are uneven, there's rugs, stuff like that. You could trip, fall, hurt yourself, and that's the last thing you need in somebody's home. And then hospice nursing is meant to provide the highest quality of emotional, physical, and mental care in the end-of-life stage. During the end-of-life process, it is very important to remember that these people are at a very vulnerable time of their lives, no matter what type of care that they are going to receive. End-of-life care can come in many different shapes and forms. And maintaining a positive mentality for all your patients is a huge part of the process. With a positive mindset, you would not imagine the confidence that your patients will have in themselves. Patients must always be informed, cared for, and consenting as to what is being done and provided to them. Hospice care, no matter what shape or form that it is given or received in, is one of the most rewarding and positive healthcare settings you could possibly work in. And the care, compassion, and empathy that is offered is something you will not find anywhere else. Thank you.